Good afternoon or good morning, as the case may be, and welcome to this web session, on reducing jail use through diversion and deflection. My name is Jesse Janetta. I am a senior policy fellow in the Urban Institute's Justice and Safety Division. I want to thank you for making the time to join this webinar session, which is the first in a series sharing some of what's been learned from local justice work to rethink and change how jails are used, supported by the Safety and Justice Challenge. I've been leading Urban's work as a partner in the Safety and Justice Challenge since 2015, and very excited to have the opportunity to work with some of our local partners to talk about what some of that on-the-ground work has looked like and why we have done it. Before we proceed further, will share a couple of housekeeping items. This event is being recorded, and the recording will be posted online afterward for either you to come back to or for others who had to miss it to come and listen to it. Speaker biographies and related materials are available online. We'll be putting the link to that in the chat. So if you want to learn a little bit more about everyone who's among the presenters and also do some deeper dives into related material to what we'll be covering today, that will all be there. All the participants are muted. And so what we'll be doing is inviting you all to type your questions or comments into the Q&A box that should be at the bottom of your Zoom menu bar screen at any time, all throughout as we go. And then when we open it up to the discussion, we'll be having that guided by what's come in from that Q&A, and we should have timed it so there will be a good amount of time to answer your questions. And finally, if you need to or want to, you can hide captions or adjust settings with live transcript button in your Zoom function. So with that housekeeping handled and out of the way, this session is going to focus specifically on front-end interventions that can reduce jail use by either preventing people from being booked into jail or creating pathways to divert them from jail after they've been booked. And the way we'll be tackling that, we're going to start the session with an overview of the reasoning behind why one might want in your local jurisdiction to rethink how jails are used, talk a little bit specifically about how the Safety and Justice Challenge has approached advancing that rethinking and supporting it, sort of to give you a sense of where some of the information and work that you're hearing about has come from. And then you'll hear in turn from our partners in Summit County, Ohio, and East Baton Rouge Parish, Louisiana, about work in this line at the front end that they've undertaken to improve their local justice practice and reduce the use of jail. Here is your presentation team, and as people have been adding, I will reiterate that speaker bios for all of us, if you want to know more about who we are available at the event page. We'll redrop that link in the chat. And so with that, away we go. Why might one want to rethink jail use? Just some context setting on this question. And it's important, if you're not already aware, and you may be, to recognize that a basic answer to this question is that jails touch millions of lives each year in the United States. On any given day, there are more people in prison than are in jail. But because of the short-term nature of most jail incarceration, that greatly understates how large a part jails play in American incarceration. We look at around 8 million admissions annually to jails in the United States. Now, some of those are duplicates. Individuals are certainly sometimes booked in jail multiple times over the year, but you're still talking about millions of lives that are affected directly by jails as an institution. Jails operated locally, usually at the county level, but sometimes municipally or sometimes by the state, primarily operate as pretrial detention facilities. Nearly 70% of people in jail on a given day are held there pretrial. And also important, I think, to mention that, as with essentially every form of contact with the criminal justice system, there are large racial disparities in jail incarceration, particularly to the disadvantage of Black and Indigenous Americans. Also, can be critical to think about and potentially rethink how jails are being used because there is research evidence that suggests that even short stints of jail incarceration can make further justice involvement and offending more likely, which is to say that in part because jail incarceration can be destabilizing and disruptive to people's lives, it has at least the potential to exacerbate some of the safety problems for which jail use may be intended as a response. Also, a critical part of thinking about how jails are used is recognizing how prevalent serious mental health issues and substance use and addiction issues are among the jail population, including often people who may be in the most acute forms of crisis and intoxication do make up a substantial and the most challenging portion of people that are booked into jails, and the jail staff has to figure out how to safely manage their time in jails. I have been in multiple settings where either a sheriff or a jail administrator has said, we operate as our jail the largest mental health hospital essentially in our county or in our city or in our jurisdiction. So jails really are, in a sense, a triage spot for a lot of untreated or unmanaged or out of control mental health and addiction issues. Finally, significant public expenditure is made on jails, and like any public safety investment, this always raises the question of what is the return on investment for what's spent in jails, at least as they are currently used, and how does that compare to other ways we might be able to invest not just our money, but our time and our energy, particularly of our frontline justice personnel, in best supporting safety and justice in our communities. Also, important to say that when we're talking about jails, most people who are booked into jail return to their communities fairly quickly. So what you're seeing here is data on average length of jail stay in 17 safety and justice challenge sites that have been reporting their jail data since 2017. And you can add into this the national average length of stay in jail as reported by the Bureau of Justice Statistics. So you can see that there's some variation in this, but typically what you're looking at is an average length of stay in jail of about a month. And even in the Safety and Justice Challenge site that was reporting the largest average length of stay, which was 96 days, that is a little over 3 months. So it is, I think, always helpful as we're thinking about jail use to bear in mind that when people are coming into jails, for the most part, they are back in the community before too long. And in fact, the average length of stay in jails can obscure important facts about how that tends to manifest because the average is often driven by two tails of the distribution. You have a large number of people who are booked into jail who are cycling in and out very quickly. And then you have a small number of people that may be held in jail for a very long time. Often they may be pretrial detainees who are facing a pretty serious criminal case that's taking a long time to resolve. So what you see here is the same 17 SJC sites that were included in the data in the previous slide. And this is showing what percentage of bookings are people who are held for 3 or fewer days. And you can see that there is variation in that. There are some sites where, it's only a small number of people that are in and out that quickly. But in most of these jurisdictions, and I think this is not unusual, it's more than half, and often well more than half of people who are booked into jail are released in 3 days or less. And this does raise the question about what this says about use of resources. Can some of these bookings be avoided entirely? Or if somebody is booked in, can a jail release that's going to happen very soon anyway be brought about more quickly? And the strategies that our site partners from Summit County and East Baton Rouge Parish are going to talk about are in that vein. One of the reasons that focusing on jail use can be a really powerful lens for thinking about local justice practice more broadly is that the population in a jail, how large it is, who is there, how long is there, is a product of all kinds of justice processes and practices at the front end being under the control or at least under the influence of independently operating agencies and actors that together form what the jail population is. So this can span from law enforcement priorities and arrest practices through every element of the criminal court process, things like the role of cash bail versus risk assessment and other mechanisms in pretrial release, what the capacity and staffing is of the jail, how many people on a given day can the jail actually safely house, responses to parole violations, and many other things. And of course, the social service systems addressing homelessness, addressing mental health crisis, addressing substance use issues, what they are doing and how they're doing it also meaningfully influences the jail population. All of this is to say that when you're thinking about jail use, where you're looking for the impacts of how you might be thinking about changing that is within the jail. But when you're talking about who is doing what and what kinds of issues do you need to focus on or processes, what partners you need to engage, that is going to be quite broad and different. One of the lessons from the Safety and Justice Challenge, I would say, is when you look at the data, which factors are particularly important in which places can be quite different. So, with all of those things in mind, the John D. and Catherine T. MacArthur Foundation launched the Safety and Justice Challenge in 2015, recognizing the importance of jail incarceration for all the reasons that I've laid out and more, that jail use has gotten traditionally relatively little attention compared to other justice issues. When people are interested in incarceration, jail incarceration has traditionally gotten a lot less attention of all kinds than prison incarceration, but also recognizing that there was a growing and robust base of good local practices in areas such as pretrial release that had been developed and tested and collectively might present a roadmap or at least a toolkit of different things well worth trying for other jurisdictions around the country that want to take a more strategic approach to how they're using jails. But it's very challenging sometimes to spread those effective strategies and that knowledge because jail operations are so decentralized, as are law enforcement, prosecution, defense, the courts, community supervision. All of these things are highly decentralized in the way they are operated, which means that it can be very challenging to try and affect the way jail use is happening in the United States. You have to be present and influential in a lot of different places. So, and there's a lot of pieces of the Safety and Justice Challenge, but the ones that I'll highlight, the foundation made a multi-year, very large investment, first and foremost in providing grant support to local communities to better understand the drivers of their jail population through data and using that to identify and implement strategies that would make sense to try to safely reduce their jail populations. They complemented those large grants that are the backbone of the challenge with smaller grants and peer learning networks as ways to bring in other places that weren't necessarily going to get those large investments, but still wanted to try things or had a lot to bring to the collective learning process. And for example, the Urban Institute, we began our work as an SJC partner by designing and running a microgrant program called the Innovation Fund, which provided small grants and technical assistance engagement, ultimately supporting 32 local jurisdictions in trying innovative approaches, things they wanted to test out that they felt probably had a relationship to how they were using jail and wanted to see what they could do if they could stand up a pilot or an innovation, or in some case do some infrastructure enhancement. And I will say that both the communities that you'll hear from today got connected to the SHC initially as recipients of one of those Innovation Fund grants. So by doing all these things together, supporting and engaging local jurisdictions together, the challenge built a large community of practice of local innovators in local government and in communities, supported by a very large number of expert organizations, including those representing, for example, some of the important justice professions that need to be part of any collaborative effort to change jail use. So, for example, the International Association of Chiefs of Police for the law enforcement community, the National Legal Aid and Defenders Association for the Defense Bar, the National Center for State Courts for the judiciary, and I could go on, but won't. You can go see at safetyandjusticechallenge.org everybody that's involved. But I think they wanted to meet the challenge of how many different professions and agencies and sources of expertise and investment in the jail population, how challenging that was with an effort that was broadly inclusive enough that it could mirror as much as was possible that situation and who needed to be involved and what kind of knowledge and expertise needed to be part of it. And then the goal was to use this network to share and spread strategies first within the network so that everybody that was part of the challenge in various capacities was learning as much as they could to advance their local work, and then going beyond that to carry that learning out. And this webinar and the series it's part of is a portion of Urban's work of trying to do that piece of the challenge. So the SJC sites, when you think about, well, what did they do? And like we're spotlighting some specific things, they fielded strategies across every part of the justice continuum, trying to find ways to make use of their jail more strategic and mitigate the downsides of jail incarceration. I would say SJC work is very practical. And I think of all collectively our partners in, but pushed to be practical by our local partners who are like, we really need to understand in a nuts and bolts way how to do some of these things and how to build collaboration at the local level that's necessary to be successful, because almost any strategy that's going to impact the jail population is unlikely to be successful, if not impossible to be successful, if only a single agency or actor is doing it. You need to work across agencies, systems, and in most cases involve the community in some capacity as well. So that's a little bit of the undertaking that all what you're going to hear today is stemming from. And so the last thing I want to leave you with, so, we said, for example, that part of this was about trying to reduce jail populations and change jail use in that way. You're probably wondering, okay, well, what at a top line has that looked like? So part of what you're looking at here is the long-term jail trend in the SJC sites that began their implementation in 2016 compared to nationwide jail trends as reported by the Bureau of Justice Statistics. And what you can see is there are sort of eras in the SJC. In the first 3 or so years, the SJC sites did see a modest but significant reduction in their jail populations. That was a trend that you don't really see in the national data. And then, of course, the most seismic event over the last decade in jail populations was the COVID pandemic and the response to it, which resulted in large drops in jail population essentially everywhere in the United States. And then after that, you have seen jail populations increasing from the lowest level they got to in 2020, but still below 2019 levels. And you see here the link to safetyandjusticechallenge.org. The SJC sites that got the large grants are reporting data, which is brought together by the CUNY Institute for State and Local Governance, and on a lot of key metrics of the jail population. They make those available through the SJC website, including you can look often jurisdiction by jurisdiction. One of the things that you will see in the most recent patterns when you look at that is, in a lot of ways, the SJC sites, in terms of more recent trends, are sort of in two categories. In some sites, what we've seen is that the jail populations have essentially rebounded to where they were in late 2019 before the COVID pandemic. And then in other sites, that jail population reduction has rebounded a little bit, but it has sort of stabilized at a level or has remained at a level that is still lower than it was before the pandemic. And I think, we will see as the years go on what those trends look like in terms of jail population. And then finally, I've said it many times that the idea is to safely reduce jail populations. There's a reason safety is the first word in the Safety and Justice Challenge. And so the relationship between SJC work and public safety can be complicated to untangle, especially over the last 5 years that have included huge events nationwide that have affected crime and safety, certainly the global pandemic, and then for example, the large spike in violent crime in 2020 and 2021 in particular, followed by large-scale declines in violence with many cities, this past year seeing levels of lethal violence at the lowest in many decades. But having said that, there are a couple different ways to do this. And so what I'm sharing here is a figure from a longer report by CUNY ISLG with that data that the sites are reporting that I had mentioned. And what they're looking at here is the pretrial release recidivism. Again, as I mentioned, most people in jail are pretrial detainees and therefore they're released pretrial. And so the recidivism of people released pretrial is not the only way that you might look at what's going on with public safety, but it is an important way. And what I would say largely when you look here is that for the most part, changes in pretrial recidivism rates have been pretty minimal. This is a fairly consistent portrait across the SJC period. But I think when you put this alongside the fact that jail populations have reduced, one of the things that you can see here is, at least in the aggregate across these sites, jail population reduction that is substantial can exist at the very least right alongside pretrial release recidivism outcomes that are the same as prior to when that work began. I will also say, if you want to go into the report, and we do have a link to that on the event page that's been linked to, this analysis was also done specifically for violent pretrial release recidivism, and that is at lower levels because violence is less common, but the pattern is largely the same. So having set down all of that context to ground the conversation, I'm excited now to hand it over first to Lori Pesci from Summit County, Ohio, to share some of the work that they have done there in, looking to change the way that the jail is used. So Lori, take it away.
Thank you, Jesse. Good afternoon or good morning to our West Coast partners. I'm Lori Pesci, like Jesse said. I'm the Director of Public Safety for Executive Eileen Shapiro here in Summit County. That's in Akron, Ohio. Thank you to the Urban Institute for inviting me to talk with you all today, and thank you for spending your time with us. I want to talk about what we've done in Summit County. Jesse, you can advance slides. Appreciate that. So our program was under the Innovation Grant back in 2017. We developed the felony summons program to help divert low-level felons from jail to save those bed days, as Jesse was talking about, the 1 to 3 days that folks were spending in jail. So I want to talk a little bit about why it mattered to Summit County. You can advance, Jesse. Thank you. We have a population of about 500,000, a little over, and we have a full service jail with almost 700 beds. So at the time we joined the Safety and Justice Challenge back in 2017, we were looking at budget cuts. We were closing parts of our jail. There was overcrowding happening already. We are lucky enough to have a very collaborative county. So we had some initiatives in place. We had a jail operations advisory commission and also a jail capacity subcommittee, which was a committee developed under our local CJCC, that looked at sort of the boots on the ground day-to-day activity in the jail, who's in the jail, who can we process out of the jail to avoid these overcrowding issues. What we realized through that committee is that approximately 70% of our jail population were pretrial felons who were awaiting processing. And typically in Summit County, we operated under the assumption that all felons required arrest and jail booking. But under Ohio law, we didn't have to follow that necessarily. So we looked at other ways we could divert some of these low-level felons. Like Jesse mentioned, those jail beds are finite, so we had to manage them the best we could under the circumstances we were working under. Okay, Jesse. So our goal when we joined the innovation program was to again reduce the felony jail admissions, also while maintaining public safety. That is a key. Certainly, we were not going to put something in place that would jeopardize public safety for our community. We also wanted to ensure we were preserving judicial authority in terms of having what the bench was able to do with these defendants. And we also wanted to ensure what we were doing was consistent across the board with all law enforcement. So we created a structured and evidence-based system or process in order to determine whether folks who were arrested under a low felony offense could be diverted from jail. Jesse, next slide. So what we wanted to talk about with our stakeholders is what this program was and what it isn't. It really is just an opportunity to take individuals who typically would be receive a signature bond or a PR bond and divert them from jail and saving those 1 to 5 bed days per individual. Certainly, we were not decriminalizing offenses. Again, focused on ensuring we were not removing judicial authority. So we wanted to make sure that law enforcement knew this was safety driven, that they had buy-in in this process along with the bench. And again, it was just specifically focused on those low-level felons. Next slide. So as we set up the evaluation, we essentially used our felony pretrial services assessment where they routinely recommended people for signature or PR bond. And so whatever that assessment they were using, we mirrored to the officer in the street, and they were able to go through the evaluate the circumstances under which people were being arrested, ensuring that violent offenders were not getting summons, high-risk repeat offenders were not getting summons, weapons, if there was an offense against involving law enforcement, they would not get summons, domestic violence, even misdemeanor domestic violence, not summons. But again, and at the time, we were also seeing a significant increase in drug-related crimes. So we found the focus was mainly these low-level felon drug offenses that were really ended up being summons for the most part. Next slide. So our screening process, again, mirrored our felony pretrial services evaluation. It looked at the current charge, criminal history indicators, if there were pending cases, warrants, ensuring we were able to identify people, verify that identification, checking access to weapons, and other social stability factors. So the officer had discretion, still could take the person into custody in the street if they felt they needed to. The city of Akron also has a police legal advisor that they were able to contact and ask if they had any questions regarding whether the individual should be summoned or not. So again, following an established pretrial services risk determination, we were again able to overlay that process for officers in the street to make a determination there to potentially avoid bringing a person into the jail. Next slide. So as we piloted, we used the city of Akron piloted for us. It's our largest jurisdiction. Certainly, they were the primary driver of our jail admissions and our capacity issues. So two things that were our focus. Messaging with our partners. As Jesse mentioned, collaboration is imperative, especially if you're going to do something that involves so many different parts of the system. So messaging and finding a champion to help move this project forward. So in terms of messaging, we ensured that we had law enforcement involved, the prosecutor's office involved, and the bench involved in throughout this whole process. Excuse me. And we also had our chief prosecutor at the time for the city of Akron was Gert Wilms. She was the primary driver of this. She had the political capital, the relationships with law enforcement, with the bench, with the prosecutor's office that really helped make those inroads to those different stakeholders to get buy-in. So she essentially led this effort through the prosecutor's office. And eventually, throughout our participation in the Innovation Fund program, we had 10 agencies, law enforcement agencies in Summit County participate, which represented about 43% of our arresting agencies. How we did that was, again, using those relationships, that collaboration, making sure we were coordinating with the bench, with the prosecutor's office, ensuring that we were having discussions with law enforcement and roll call briefings and in-service trainings, and offering some follow-up for law enforcement for any questions. Because as we rolled this pilot out, we did find that we had to make some tweaks over the period of the project. So we wanted to make sure we were communicating with all the participating agencies to ensuring that we were applying this consistently throughout Summit County. Next slide. So how did we measure success? When we looked at the data prior to our application or throughout our application process, we noticed that about 4,000 defendants in a single year were deemed appropriate for release through signature or recognizance bonds. And with about 11,000 bookings a year that we have in Summit County, that represented about a quarter of reduction in bookings and releases. So we were hoping to get to capture a piece of that. And what we found was in the first year, we had over 700 summonses, which was far more than we expected, particularly because it was such a culture change, in addition to an operational change, but it was such a culture change for so many different stakeholders. We were thrilled to see that people were using it. And again, I attribute that to the collaboration piece. Most of those summonses were, again, as I mentioned, fifth-degree felonies, mostly for drug abuse. And the most interesting thing we found in the data was that those individuals who were summoned had a better appearance rate then those individuals who were being screened by pretrial services for a signature or PR bond. So we did find that those folks that were being summoned in the street by officers under ensuring that they were using the criteria properly had a better appearance rate in court than some of our other folks that would have actually come to jail and then received a signature bond or PR bond. So the way we and so in moving this project forward, what we did was ensure that these processes and procedures were ingrained in policy, in operations. So the police departments that participated, it is now part of their, again, in-service training, part of their policies to ensure that this this program is sustaining. Now, we implemented in 2017. We collected data to determine the efficacy of the program. It certainly, we did see initially and continue to see that we are not receiving these low-level felons into the jail. We have a relatively stable jail population today. And so we continue to work through this program, and we're hoping that at some point we will see all of the law enforcement agencies in Summit County using it. Again, it's a significant cultural shift, so that some of it has taken a lot of time, obviously. But again, I can't emphasize enough that messaging success, messaging what the project is, and finding that champion to help build those collaborations were key in helping promote this project and making it such a success. So again, it to us it was one of those aha moments, like, we're doing this for misdemeanors, why aren't we doing it for felons? But there is a whole shift in mindset, and using that messaging and using a champion to help push that forward was our key to success. So, and with that, I will kick it off to the Baton Rouge team.
All right, thank you, Lori. And good afternoon and good morning. I'm Niles Hamer. I am the Deputy Director of the East Baton Rouge Parish Criminal Justice Coordinating Council. And I'm also the Program Director of our David O'Quinn Pretrial Diversion and Recovery Program. I'm joined by Lisa Burns, our Case Manager for the program, and also Debbie Norwood, who is our Resource Coordinator for the program. I'll allow them to introduce themselves later when they start their presentation, but I'll give you a little background on our program here in East Baton Rouge Parish, Louisiana. Next slide. So as I stated, it is the David O'Quinn Pretrial Diversion and Recovery Program. Next slide, please. And before I get started on how this came about with the money and everything, here in East Baton Rouge Parish, we have a population of about 450,000 people. Most people, when they hear Louisiana and the most populous city, everybody knows it's New Orleans. But the most populous parish is East Baton Rouge Parish, which is essentially the capital city of Baton Rouge, Louisiana. A lot of people don't know that we're the most populous place in Louisiana, but East Baton Rouge Parish is. And also in Louisiana, we're a little different than the other 49 states. We don't have counties. We have parishes. Parishes are just like counties. It goes back to our civil law founding with the French, and the Catholic Church had a big influence on us. So instead of having counties, we have parish. So we are the Criminal Justice Coordinating Council of East Baton Rouge Parish. But we started our pretrial diversion and recovery program back in 2018 when our local Baton Rouge Area Foundation, which is a philanthropic group, community group here in Baton Rouge, a foundation that combines financial and social services to better the quality of life here in Baton Rouge. It started off with a $50,000 innovation grant by the John D. and Catherine T. MacArthur Foundation as part of the Safety and Justice Challenge. Jesse has talked a lot about the Safety and Justice Challenge. We were not a part of the original cohort, but we eventually became a part of the Safety and Justice Challenge in 2019 as a innovation site first in 2018 and as an actual SJC site in 2019. Now, the Baton Rouge Area Foundation, with this money, collaborated with our local state court, which is the 19th Judicial District Court here in East Baton Rouge Parish, our local DA's office, and our public defender's office, along with our sheriff's office, to bring this pretrial diversion and recovery program about. Now, the program's intent is to identify incarcerated individuals with behavioral health needs that would be better suited in treatment rather than jail. I started off by saying the name of the program is the David O'Quinn pretrial program, and it's David O'Quinn was an individual who was arrested, had a behavioral health issue. He was placed into a restraint chair in our local East Baton Rouge Parish Jail, left there for hours. Some type of health complication occurred, and he ended up dying. The family filed a lawsuit, and I believe the lawsuit was settled, and those settlement proceeds were used because the family did not want this to happen to anybody else. Those settlement proceeds were used to create this pretrial diversion and recovery program. Next slide. Now, our program isn't your typical diversion program. When you hear diversion, I'm a former prosecutor. I'm also a former public defender. But when you hear diversion, you think of first-time offenders. There may be a cost that you pay to the DA's office for the diversion program, and you usually complete some classes, do some community service, charges are dismissed. This is a different type of diversion program. There's no fees to participate in this program. We target individuals who are incarcerated, who are indigent, who cannot get out on a cash bail that has been set for them. We still have cash bail in Louisiana, and usually it is, and not usually, all the time, it's nonviolent offenses. So the program is budgeted to cover up to $500 in participant costs, and that assists with transportation, clothing and hygiene products, initial costs for rental, for housing in their sober living housing, and our case manager will talk a little bit more about that later, any drug screening costs. The program currently is funded by opioid abatement settlement funds that have been given to jurisdictions all across Louisiana and also all across the United States of America, and a settlement a couple of years ago where these municipalities were able to get some funding to really combat the opioid crisis locally. And that's what we're using our funding for. We receive about $260,000 from our local city parish government. It essentially funds our program, pays our staff, and also pay the cost that you see per participant for participating in the program. Now, there are benefits to this program, and our case manager and our resource coordinator will get into more details. But one of the benefits, instead of being warehoused in jail where you just sit in jail because you cannot afford a cash bail and your charges are only maybe possession of Schedule II drugs, and you don't have a violent history, you just have a drug addiction, you can't afford to get out. Instead of just sitting there and waiting till your case is adjudicated through trial, which takes a while here in East Baton Rouge Parish, we give you the benefit to access treatment earlier. We get you out of jail to get to that treatment. There's comprehensive case management. We provide support, guidance, and mentorship, and there's opportunities to build life skills through this program. But the biggest carrot on the stick, of course, is the case is dismissed by the DA's office. You don't have to be a first-time offender. You can have a lengthy rap sheet as long as it's not a violent history, and you can qualify for this particular program. And at the end of the day, it could be multiple files. You can have your case dismissed once you go through the program. Next slide. So I'll turn it over to our case manager, our licensed clinical social worker, Lisa Burns, who will talk about how the program actually works. Lisa?
Thank you, Niles. As he mentioned, I am the case manager, and the program started in 2018, as mentioned before, but I didn't start working till the week with the program until the week before COVID hit. So some things have changed as far as how we get our participants, but we go through the call out each day, which is the paperwork that is submitted for each person that is arrested and brought to jail, and before their bond is set. And we review the charges and determine whether uh, we look at the affidavit of probable cause and determine if they might be eligible for the program, meaning it's a non-violent charge, as well as whether they may have any recent recent violent convictions, because as mentioned before, we only accept non-violent felony or misdemeanor charges. And just like Lori mentioned in her presentation, what we find mostly is it's low-level drug offenses that we're dealing with. Many people are homeless. They've lost contact with their families. They've lost contact with their jobs, and because of their behavioral health issues or including substance use disorder or mental health conditions, they've become disconnected from society and yet, end up in jail. So the district attorney has the final approval. So we may submit names to the DA. We have a designated district attorney, a designated public defender, and a designated judge who handles this program. So the DA has, as I said, the final approval, but they look through their rap sheet and determine if there are any other violent offenses, and that would disqualify them, such as domestic violence or anything like that, anything with a gun. So those types of cases are not accepted, again, considering public safety. So once the district attorney approves for someone to participate, I do a psychosocial evaluation, including their past and current substance use history, any mental health treatment. I try to get collateral information when I can, but it's a voluntary program that the person is committing themselves to a minimum of 6 to 12 months. And during that time, they will go through inpatient treatment and then into the sober living program and all of that. But once they're accepted into the program, they also they get a release on their own recognizance bond, meaning ROR, don't have to pay any fees. As Mr. Niles mentioned earlier, there's no fees associated with this program at all for the participant, other than once they get into the sober living. And Miss Debbie's going to talk about that a little bit more. But they're released to me and or Miss Debbie, and they go straight from the jail to the treatment facility. I think it's important too to mention very quickly that not only are they connected with the resources that they need for their substance use disorder, behavioral health issues, they're also connected to a primary care physician. So their overall health and well-being is taken into consideration. And as we know, people living on the streets, people using drugs tend to have more issues with health and dental problems, things like that. So that is all considered and taken into consideration and provided for during this program. So I think at this point, I'm going to turn it over. Next slide, please. And I'll turn it over to Miss Debbie Norwood, who is the resource coordinator. And she's been with the program a lot longer than I have, but
Good afternoon. My name is Debbie Norwood. I am the Community Resource Coordinator for the pretrial program. I started in December of 2018. after doing an early retirement from the East Baton Rouge Parish Sheriff's Office. 14 years of that 23 were done inside of our parish prison. So I've kind of worked on both sides thus far. But after the participant transitions from the inpatient phase of the program, that is when we start their intensive outpatient program, where they are moved into a sober living facility. They begin the IOP phase, which will last 13 weeks. They are given 13 assignments where they work on each assignment and present an assignment a week in front of their group. Our treatment providers also require that they go to a minimum of 3 AA meetings a week, and also obtain an AA sponsor, which they have to meet once a week. And they do this from the very beginning, and that is so that from the beginning, they start building a support system for themselves for after they do graduate from our program and our treatment providers program. Also, they are to obtain a full-time job. This usually happens within the first couple of weeks, and that is to be able to pay their rent, which, like Miss Lisa said, is the only cost to the participant is their rent. And last but not least, part of their treatment plan, and I believe is one of the main reasons why this program is so different and that it does work, is they have to do daily call-ins at the very beginning. They will call me and contact me each day from the beginning. And this is just to give them support, give them ideas, answer any questions they may have. It helps them remain in compliance with our rules and our providers' rules. Or sometimes it's just to talk and find out how their day went, or to even plan what their next day looks like so that they can actually live one day at a time. A lot of our participants are homeless. Some have not had a job in years, and a lot of this can be very overwhelming at the beginning. So to give them the best resource and the best way to be successful is to basically walk them through, especially the first 13 weeks. Throughout those 13 weeks, once they do get a job and they start getting on a routine, those calls can cut back, but towards the end, they're still calling in 1 to 2 times a week to check in to make sure that they are in compliance. Also, during this 13 weeks, they are provided with numerous resources, which are anything from helping them to write a resume, to finding employment, which we have a place, Goodwill, that we use. They offer gift card incentives if the participant allows them to help them find a job. They help them register for SNAP benefits. They can assist with government phones if they don't have a phone when they come out, which most of them do not. They obtain free bus passes for our city transit system. They offer job readiness training, and that's only to name just a few. Plenty of resources, and we hook them up with those resources. We follow through with that and make sure that they follow through also. Along with this program, we have weekly staffing. We do try to get all of our team members to be a part of this weekly staffing. And this is where we let everyone know with the team who's in compliance, who's in not, who is non-compliant with the rules. See if they have to let everyone know who's found employment, where they're working, if they're attending their IOP groups, everything from if they're going to their AA meetings and who their AA sponsor is. And if everyone cannot be a part of this weekly staffing, we also have a mandatory monthly status hearing conference that we have once a month. And this is going to include the judge, the ADA, and the public defender, along with the rest of the team and all of our participants. And this gives the team the ability to give updated information on each participant. Each participant is called up to the podium in court, and they are allowed to talk with the judge and talk about their own personal journey, whether they are in for 6 weeks or they've been in for 16 weeks. Of course, it changes every month as they become further and further involved in their sobriety journey. And this once a month is also where we conduct our graduation. When people have completed their anywhere from 6 to 8 to 9 months, this is where they come to graduation. They are presented with a graduation certificate. We give them a little small memento, I'm sorry. And also they are given a letter of dismissal, which is the main thing that they're looking for from the assistant district attorney. And if we are having anyone that needs to be administratively discharged from the program, that is also held during these hearings. So that is a wrap up of what I do. And I'm going to send it back to Mr. Niles.
All right, thank you, Debbie. And these are numbers that we are proud of with our program. It doesn't tell the story behind some of the numbers. We've actually saved lives. We've seen people who have gone from near-death experiences to going through this program, and now they're homeowners years later. So we're proud of what we do. We've also had situations where we had participants abscond from the program, and then they later died of drug overdoses. So we get the highs and lows of it all when you're dealing with this opioid crisis that's really has smothered the nation. But this program works. Over 350 assessments have been done, over 240 individuals accepted into the program, nearly 100 graduates from the program, and we have a less than 12% recidivism rate. We're proud of those numbers. Those numbers I thought could be higher, but there are other programs that our CJCC works on that has actually led to a lower jail population, which means we have a smaller pool to pull from. Back before COVID, when we started the SJC, with the SJC, we had nearly 2,000 individuals as a daily, average daily population in our local jail. Nearly 2,000 for a parish the size of East Baton Rouge, which is, like I said before, about 450,000 people. There's metro areas much larger than us that have less than 2,000 people in their jails as far as a daily population. However, with our work through the SJC and our work on different programs locally, we brought that jail population down at one time right to about 1,000. So we were almost 50% less when we hit COVID. It's spiked up a little bit, but it is nowhere near the 2,000 mark that we were back in 2016 and 2017. So we are proud that this program helped contribute to bringing those numbers down. And we are proud that we are one of those programs that people often talk about when they talk about the justice system and how it can work and do things differently other than the traditional model that most court systems use. This is totally different. It is pretrial specialty courts, and you don't find a lot of pretrial specialty courts. A lot of specialty courts, you plead guilty to get into those specialty courts. This one, you do not. And at the end of the day, like we stated before, the individual's charges are dismissed. Next slide. So we finished with our contact information. If you want to get in touch with us, and I know there's going to be some questions that we can answer later, but this is our email address. Go check out our Facebook and our Instagram and our LinkedIn. We are ebrcjcc.org on the internet, so you can always check out what we do. We're proud of the work that we are doing with our pretrial diversion and recovery program. And with that, I turn it back over to Jesse.
Thanks, Niles, and Debbie and Lisa, and also Lori. So before I bring all of our panelists in and start navigating the questions, just wanted to preview. I'd mentioned off the top that this is the first in a series, and so if you registered for this, you will get, don't you worry, numerous emails about these as they're coming up. But the tempo of the series building on this is to continue. Next one around things that are more related to pretrial detention and release. And then on March 12th, around the prompt resolution of cases, which can be really critical for particularly some of the longer staying people in pretrial detention. And then at the end of March, forward-looking one around the future of local justice innovation. So if you enjoyed and were intrigued by what you heard today, we'd invite you to both join these later sessions and spread the word. And with that, I think we can invite all the panelists in and take down the slides. And so what I'm going to try and do, so I think part of what makes this a rich conversation is that these are related in some ways, but also quite different interventions in terms of where their scope, the intensity, and or even the presence of, more service and treatment interventions. But I'm going to try and find some questions that bridge across that a little bit. And the first one, I'm going to start with a specific question that was for you, Lori, and then I'm going to expand it, building on somebody else's question to bring everybody in. So, one of the participants asked specifically in Akron why the prosecuting attorney in the police department wanted to do this, sort of what was their motivation and the problem that they wanted to solve. And then after you answer that, I would invite you to respond to one that's about some of the mechanisms that reinforce the collaborative approach and how you address conflict within it. And then I'll turn that over to the East Baton Rouge Parish folks too. I think this question of, what did you need to do to manage, to tend to the collaborative approach and manage conflict within it as it arose. So Laura, if you want to start from why Gert and the Akron PD wanted to do this, and then how you reinforce the collaboration approach.
Sure. So, as I mentioned, our chief prosecutor, Gert Wilms, let me step back. We have a criminal justice coordinating council who oversees the operations of our system, essentially. And one of those subcommittees is it's gone through many iterations. It was a jail overcrowding subcommittee, jail capacity subcommittee. I think, has been renamed since. So we're very lucky in Summit County. We are very collaborative. So all of our stakeholders are at the table for that subcommittee. And it's both decision makers and boots on the ground. So we can talk very practically about decisions and the impacts and things like that. And so we're in these meetings, we're talking about what the population looks like. We're seeing it's mostly these low-level felony offenders. We know that they're not taking up many bed days. We know a lot of them based on the criteria. As we looked at the pretrial criteria for issuing recommendations for signature bonds and PR bonds, it was a lot of those folks. So it just sort of made sense to use that criteria in the field rather than have the person tie the officer up and coming to jail, do the intake, taking up bed space for that 1 to 3 days, 1 to 5 days. And because Akron is the largest municipality, in fact, probably half of the population of Summit County, and probably 70–80% of the individuals in the county jail, they were very interested in having bed space. And so it was their problem to solve, essentially. It was their issue that they were having. And while we were doing other tweaks in the system with other stakeholders, this is someplace we thought we could really focus on. And so on top of that, Jesse, I know you asked about collaboration, and so we were lucky enough to have that infrastructure in place where we battled it out on a monthly basis sometimes because of these competing interests and the different cultural mindsets and things like that. But we had and we have a very well-established team of people, team of stakeholders that are able to really talk about those tough issues and, walk away, maybe not getting their way, but understanding it's for the good of the system as a whole. So, yeah, we were, again, Gert, or as a chief prosecutor, drove that. She had a lot of political capital, personal capital, relationships with the police department. So she personally went out and ensured that everybody understood what the program was about, understood what the criteria was, and like it was a constant conversation with stakeholders. Like you just can't say, "Hey, we're going to implement this," and walk away from it. It throughout the innovation fund period and beyond, we were having conversations with stakeholders, and that was really one of the keys for us.
So, from an East Baton Rouge Parish standpoint, our turning point was actually just prior to COVID, with the average daily population of over 2,000 individuals in our jail. We realized that something had to give. We didn't have enough bed space. A lot of the people who were being detained had to be detained in more rural parishes. Although they were in our custody, we just didn't have the space. So our local government was paying extra money to house individuals in different parishes around the state of Louisiana. And it just became so much of a crunch for us that they had to do something. So when they came up with the pretrial diversion and recovery program, there weren't many naysayers, because we were only focused, and we still are only focused, on nonviolent offenders and trying to get them out of jail and into some type of treatment. So many of the justice stakeholders were all on board, saying it's pretty good, we can do it. Then COVID hits, and we further proved that we can reduce the jail population without increasing the public safety risk. So it kind of showed that this program worked before COVID, and it worked post COVID. And a lot of people feel as though many jurisdictions should try to take up what we're doing here, because we're getting people out early in the process and getting them treatment. They don't have to plead guilty to get that treatment. And it's kind of worked wonders for our local jurisdiction. I don't know if Debbie or Lisa has anything to add to that.
So the next one I'll pick up, and I'll start with the EBR team, although Lori, I'd be interested in sort of how this looks in Summit as well. So the question is whether there are opportunities for people with behavioral health needs to engage with your program before arrest, or where arresting officers can get support from local providers. And I think this is for both of you, whether you have support from the local ER or hospitals to help facilitate transition. So it's sort of about, in addition to what you were sharing, I would say, what else is there, particularly for people presenting with behavioral health needs in the community, and maybe get contact with law enforcement.
Niles, I was just going to share about the Bridge Center. The Bridge Center is another facility that was opened as a result of the lawsuit that he mentioned previously, the gentleman that passed away in jail. The family donated a portion of the money that they received to fund the Bridge Center, which is an emergency room for behavioral health people in behavioral health crisis. You can either walk in yourself, or police and EMS have an entryway where there's no refusal of anyone, and they are guaranteed a certain amount of time that they're in and out. They don't have to, spend a lot of time off the street taken care of. And there's it's kind of based on the San Antonio model, but there's various points of, depending on what the person's needs are, there's various levels that they can be, there's like a living room setting if they're not violent or not acting out too much, that they can just kind of be watched and determine what might be the next plan for them. But they are all assessed and released with a plan. So yes, the answer to that question is yes, the Bridge Center here in Baton Rouge.
And that's more of the deflection model.
Right.
For our program, you actually are unfortunately arrested and charged, and we usually find you already incarcerated, and that's how you usually get into our program. But that deflection model of the Bridge Center has also worked wonders for Baton Rouge.
And Lori, I don't know if you want to say anything about some of that intervention capacity around behavioral health as it exists at Summit right now.
So we are proud to have been one of the first in the nation with crisis intervention teams. So there is a lot of focus on behavioral health in Summit County. One of the questions came up about Scout, which is our outreach team. It's a social worker, somebody from the fire department, somebody from PD, go out to crisis calls and in hopes that we can completely divert them from arrest at all. In particular, having to arrest and go to the jail. So we have some things in place. We are continually looking to uh, find ways where we can help support the folks in our community that are struggling with mental health issues. Because, as you mentioned, Jesse, at the lead of this, that the jail is really the de facto mental hospital at this point, and so we are really trying to make sure those folks are getting the services they need in the community and not in jail.
And one thing, if I may, that I'll lay on that I think has been key, certainly in East Baton Rouge Parish. So you all have had actually not only an initial, but then follow up workshops around the sequential intercept model. And I imagine a lot of folks on here may be familiar with it, but if you're not, this is a model to look systematically across the intercepts of largely the justice process. So starting with community services, so pre-contact, then contact with law enforcement, potentially including arrest, initial court appearance, jails, courts, all the way through reentry and community corrections. And part of the purpose of it is to systematically go through and recognize, all right, at each of these points that in essentially any justice system, a lot of people with behavioral health needs, you are seeing them at all these points. What do you have? What should you have? What can you have to off ramp them from deeper involvement in the justice system and really get those behavioral health needs attended to? And I think that the reason I'm bringing this up as a piece of the puzzle is like this is part of a larger thinking that East Baton Rouge Parish has done, so that the diversion program you heard about, the Bridge Center, you're thinking about that capacity, because generally you need all of that, because I've seen a lot of communities that have done great work building up their capacities at that intercept. I haven't yet seen one that is not still seeing people with those needs showing up at all those intercepts. And this is one of the things that helps make sure that a specific intervention, wherever it is, isn't trying to carry the weight of all of that work, but that you are building out to, diversionary pathways or pathways to treatment, and helping people address, their mental health issues and other issues at every point in the continuum. Right. Now we got a big queue. So this is also a good point for me to let folks know we're going to answer as many questions as we can. And I know that people have been answering them live from the panel here. We also have people's contact information. So particularly for some of the questions that might be more specific, or we're asking for more information, we'll try and get everything out in the conversation, but we can also follow up with people individually with your contact information that you use to register. So it's also going to be for the I'm going to start with EBR here. So, you guys showed some data, so that's always going to prompt follow-up questions. So I'm going to tie two together. One around when you're saying the recidivism rate is less than 12%, sort of how are you defining that, where you're looking at it? And then I think there's also a question prompted by your data around doing the math around the completion rate. It's looking like 14 per year. So do you have plans to expand the program or for increasing the completion rate? Because it does look like a fair amount of your participants don't get there. So you could take sort of related to the recidivism and the participation rate.
Yeah, and I'll start with this one. So the 12%, Lisa and Debbie, and we have what we call case navigators that work with our CJCC. Our case navigators sit out at the jail and connect newly arrested persons to resources. So when they are eventually released, they'll be able to connect with those resources. But we look through what we call jail call out, which is our first appearance docket. We look through the docket daily to see if our individuals are returning to the system. And for the most part, Debbie and Lisa, they're very good about capturing the ones that have been in our program before. We'll see them every now and then, and we'll talk to them to see how they got back into the system. So that's how we come up with that recidivism number. It's not the best way of calculating the number, but it's the best way we can do it to see who's coming through at least the East Baton Rouge Parish Justice System. If they happen to move to the state of Texas and get arrested in Houston, we likely not to know, and they probably wouldn't count towards our numbers. So we're counting people who return to our local courts. The second question, Jesse, say it again for me.
So this is saying it's looking like given the length of the program, you're looking at about 14 completions a
Yes,
year. Plans to
yes,
either expand the
yes.
program and or increase the completion rate.
Yes, so that's so we do such a good job. I'm going to brag on our local CJCC. We do such a good job. We just started a pretrial services here in East Baton Rouge Parish with a where we offer support to individuals who are arrested and released. We're using a risk assessment tool. We just did that in the past year. Judges are releasing more individuals on their own reconnaissance than they did when we first started this program. So individuals that would normally probably be brought into our program, we can't get to because they're released. And a lot of people, the carrot on the stick, other than having your charges dismissed, for most individuals, is that they'll be able to be released without posting a bond. They just have to go into treatment. Because our other programs have been so successful, that population pool at the jail of nonviolent offenders, only drug charges have been really, really, really reduced. And it's caused such a reduction that it kind of reflects in our numbers. So Debbie, Lisa, do you want to opine on that as well? So that's essentially why our numbers are where they are. We graduate on average maybe one person per month. Right now we have about 12 individuals in the program. At one time, it was nothing for us to have 20 individuals in this program. We only have a staff of 2 individuals. I serve as the program director. We do everything for the program. So if we had more than 25, we probably wouldn't be able to function properly. So it is a small program. We think it could be a bigger program, but that would mean more funding and more buy-in from probably the state legislator, because we believe we can spread the program. One thing that we didn't mention is that our program, not only can you have your charges dismissed, but we assist you if you have charges in other jurisdictions, other parishes. We reach out to their DAs and tell them that you're in the program, and we try to work it out where you can be a part of this program, and this program can be used for your charges in the other parish. So it essentially, a lot of our individuals kill 2 birds with 1 stone in this program. We also help with individuals who have issues with driving, traffic matters, outstanding warrants. We try to make you whole once you graduate this program. So 96 individuals over 7 years isn't like a whole lot, but at the same time, the people who are graduating from this program usually don't return, and their lives have been totally changed.
I did want to just say one thing that reflects those numbers also. Because our program, when we first started the program, it was modeled around a 4-month program. We have since, through research and everyone talking as a team, have expanded that to a 6 to 12-month period. Everyone's journey is not the same. You may have someone that has gone 5, 6 months into the program and then may relapse. If they do that, then we work with them. We send them back to inpatient if need be. And depending on the circumstances is whether they have to start the program over again or if they can just pick up where they were. So those reflect the numbers also because we have had several people with us for over a year. So that kind of ramps up the numbers for the following year, but not for the year that they actually came into the program. So that's another reason why. And another reason is because it is so not complicated, but it has so many different sections of it with the three phases and what all is included in each one of those phases. So it's not just an overnight program. Like Niall said, we make them whole by the time they finish. They have all of their documentation, from an ID to a driver's license, if possible, to their social security card, birth certificate. So a lot is done while they are in this program.
Um, So I wanted to pick up on a question for Lori, um, around, is there misdemeanor deflection in Summit County as well? And perhaps you could even expand that to, you've got the felony summons. So what should we understand broadly happens with people that are arrested or cited on a misdemeanor in terms of being booked into the jail?
So, we most of our jail populations are felons, and we have misdemeanor contracts with the municipalities and the other communities throughout Summit County for misdemeanor bed space. So if a misdemeanor comes to jail, it's because it was likely domestic violence or there were other extenuating safety concerns that they came to jail, and typically they would come under that contract. Otherwise, for the most part, misdemeanors are being summoned here in Summit County.
And I would add to that more generally that I would say when you think about what I had mentioned as the data-driven process for thinking about jail population drivers and where the opportunities are, one of the big differences across SJC sites is, are there a substantial number of people facing misdemeanor charges hitting jail booking in the first place? There are a number of sites where people facing misdemeanor charges are a substantial number of people in the jail on a given day, but there are others, depending on the dynamics and often like the kind of crowding and jail capacity situation, where I think, Lori, much like what you're describing, except for like very specific subset of misdemeanor charges, almost no one facing a misdemeanor charge is going to be held in the jail for any period of time. They'll like walk right in and out of booking, more or less, just because, all the space essentially is devoted for people facing felony charges. But again, like there's a huge range of like where that situation is, but you see both of them. And since you mentioned, I know that there was another question around the domestic violence, intimate partner violence exclusion that I know, Laura, you answered for Summit, but was asked about the safety and justice challenge, and kind of came up here in a different way. So someone from a statewide DV coalition was curious about whether all the SJC sites exclude domestic violence, intimate partner violence from diversion deflection opportunities, since even misdemeanor DV was excluded here. And I will say, I mean, I would not be so bold as to say for all the SJC sites, but it is common in my experience to see diversion deflection on all kinds of things. There's an exception for certain misdemeanor cases, and almost without fail, that does include domestic violence and intimate partner violence, sometimes DUI, but it is very common for misdemeanor charges related to that kind of victimization or that kind of offending to be excluded from things. Um, all right. Now I'm trying to be mindful because we probably can maybe get um to two more. I wonder for so I'm going to try and do one for EBR, and then I'll come to you, Lori, with a different one. So for the EBR team, how are you handling non-compliance, or people that, and So, and which can mean a lot of things, particularly like that could mean returning to substance use. So what does that look like in terms of dealing with people that are non-compliant in various ways in your program?
I'll start off, and Debbie, I'm sure you may have some to add, but we generally, Debbie and I try to address it with the participant themselves initially to try and determine, and perhaps that may include their counselor as well. Um, and we encourage that, trying to figure out what's going on with them and why, they're not complying. And we know research shows us that it takes the brain a long time to recover after long periods of use, particularly of methamphetamines and opiates. But so we try to determine what's driving that behavior. And if it's something that is an easy, talk it through and come up with a solution, then we do that. If it's bigger than that, we bring it to the team and discuss it with the team. Certainly allow the judge to address it in court. That's the last resort. And as Debbie said, sometimes we have to administratively discharge people. That does not happen very often, but it does happen occasionally that someone just cannot quite get it together. And that just means they're not ready, but it's very gut-wrenching for us when it happens. But as I said, we try to address it together, Debbie and I first, and then bring it to the team if it gets bigger, and then that including the judge as well. I hope that answers the question.
Yes, absolutely. Oh, I guess I didn't ask the question, so maybe it's not my place to say whether it does. I thought it did. And then this is, I think, actually a good one for all of us. So there were conversations about the power of messaging and its framework on diversion deflection. And I think we can spread this to everything. Do you have any examples of building coalitions with unlikely alliances? I guess you'll have to reveal who you think are likely or unlikely alliances in quickly answering this question.
So again, if I could build a business on how to engage stakeholders, that's what I would do. Because again, Summit County, we're very lucky. We have soup to nuts on our criminal justice coordinating council. We have our local alcohol, drug addiction, and mental health board. We have reentry folks. We have if a person would come in contact with you as a stakeholder in the community, and it doesn't have to be, you don't have to be part of the criminal justice system. They are participating. So we try and we try and recognize every interaction that people have throughout their journey, and try and engage those stakeholders, because the more buy-in, obviously, typically, the easier it is to number one, create a program that serves the community, that does what it's supposed to do, and that people can get behind. And then you have that support out there. So I can't think of any off the top of my head because everybody is a participant in here. But yeah, I would encourage you, if you find folks that you wouldn't normally think of as typical, to engage them or ask them. And people love to be heard, love to be a part of the process. So I would always encourage that.
And Jesse, real quick, I know we're short on time. I would say our unlikely alliance is with our local court, because we are the only specialty court type program that isn't housed with our local court. Our CJCC is a nonprofit organization, and the pretrial diversion and recovery program is housed with the nonprofit organization and not the local court. So it takes a lot for them to give up a program like this, but we started it, we built it up, and it's been functioning pretty darn good with our staff. So they're keeping it with us, but every now and then we'll hear little mummers about, hey, maybe the local court should take over the program.
So I'm mindful of time. I want to thank our audience, especially for giving us more good questions that we could answer. And I think we will look at these and we may post or figure out a way to address them, not just to you directly, but to everybody. I want to certainly thank our panelists who were awesome for all the work you do. Take the opportunity. I see some of my fellow leaders, past and present, of Urban's SJC work. Evelyn McCoy and Kelly Walsh and Janine Buck-Willison are here, so I will shout them out. Appreciate the MacArthur Foundation for seeding this work. And I think our panelists and everybody just want to thank everybody in the SJC who's been doing the hard local work, because without that and figuring out how to do it and generating the lessons, including being willing to share sometimes when things have not worked as well, we wouldn't be in a position to collectively show how much is possible and what kind of different thinking is, available to us if we want to take it on to make our communities safer and help people be well and thrive. So thank you for all you do and everybody else out there doing the work on the ground. So, all right. And with that, I will adjourn us.
Thank you.